Hi and welcome back to the final part of this series. Previously we talked about traditional medicine and the impact of colonialism, and in this session we'll talk about post-colonial Africa and what that looks like, and we'll have a discussion around some traditional medicine practices in Africa. So as we get started, we'll talk about some ratios or some numbers. The doctor-patient ratio as it currently exists according to recent data is about 1 to 150. So what that means is that for every one doctor, or one medically trained Western doctor this is, in Cameroon, there are 150 people for those doctors to treat. And the ratio of traditional medicine healers and medical doctors also varies throughout Africa. So we'll talk about 1 to every 100 to 700 people for traditional medicine healers. So for every one traditional medicine healer, they would be able to heal 100 to 700 people depending on where they practice or depending on the region and the availability of traditional medicine healers in that space. And this is compared to, for every one medical doctor, 987 patients to 70,000 patients for medical doctors. So the highest prevalence of traditional medicine at the moment is in Swaziland and Nigeria, and the lowest prevalence is in South Africa and Zimbabwe. And the highest prevalence of medically trained doctors outside of Cameroon, which is that 1 to 150, is in urban Kenya, which is that number that you see, 987. 70,000 is the lowest prevalence of medically trained doctors, and that is in Kilungu. And we have about 1 to 50,000 people in Zimbabwe. So what that means then is that there's a lack of access to healthcare resources, and therefore the inaccessibility of Western-based healthcare contributes to the continued widespread use of traditional medicine in Africa. And also the consideration of the cost of Western medications has also impacted the continued use of traditional medicine as it occurs in Africa. So traditional medicine is thought to be desirable still for diseases that allopathic medicine doesn't treat adequately. So because of these factors, traditional medicine is still widely used in Africa to date. In Ghana and Mali and Zambia and Nigeria, traditional medicine is the first-line treatment for about 60% of paediatric patients with high fever, and this is according to World Health Organization data. In Burkina Faso, there's increasing demand for traditional medicine to treat neurological and rheumatic conditions. In Tanzania, traditional medicine is used quite commonly for convulsions. And about 27 million people in South Africa report using traditional medicine in an integrated approach with a Western paradigm. And this is actually utilisation mostly in Indigenous South Africans. So there is a concerted effort to recognise the role of traditional medicine in healthcare delivery in post-colonial Africa. In Nigeria, there is a concerted governmental encouragement of research on herbs. They're looking at the medicinal properties with a view of standardisation of traditional medicine. There are state and federal governments that are established looking at national traditional healers boards. So these governments have established boards that look at traditional medicine with the role of incorporating traditional medicine, or the view of the systemisation or the integration of traditional medicine in various state and federal capacities. There are policies that are looking at the accreditation and the registration of traditional medical practitioners in Africa. And The Nigerian government has looked at healthcare reform, recognising the importance of traditional medicine in primary care, and this was a unanimous decision at the federal level. They're looking at studies that collate and document and preserve Nigerian traditional medicine and products with a view of integrating traditional medicine into mainstream medical practices. So in post-colonial Africa, there is a framework for the development of traditional medicine in Cameroon, which highlights health goals for the new millennium. And these goals include the reduction of poverty, the reduction of morbidity and mortality as healthcare indicators or health indicators in terms of national health, and sustainable healthcare development. So the World Health Organization has actually worked in unison with the Cameroon government to develop this framework as a strategic plan to incorporate traditional medicine into healthcare practices. And there's also development of research into herbal indications, which is really quite promising. But there are barriers to integrating traditional medicine into Western type paradigms as they exist. And one of those is mistrust, and this has a lot to do with the history of the region and also the understanding of traditional medicine. There's a very ethnocentric view that needs to be overcome so that people can understand the legitimacy of traditional medicine practices in its incorporation into other paradigms of healthcare. There are opinions among Western-trained physicians and medical students that are not in support of traditional or the integration of traditional medicine, and research indicates that there's resistance among African-trained physicians to integrate traditional medicine into practice. There's also the possibility for incorrect diagnoses and a variation in diagnoses that comes up. And the lack of understanding of drug interactions, herbal drug interactions, contributes to lack of knowledge, and also the understanding of dosage variability as it exists in traditional medicine, primarily because of its oral traditions. So in Indigenous healing practices, quite often plants are chosen according to the imbalance that's occurring in people, and plants are equally valued for their symbolic as well as their spiritual significance, as well as their medicinal effect. So it's not just looking at the plant for its medical properties, it's looking at the plant in terms of the significance of the plant, both spiritually and symbolically. And the colours of white, black and red are considered to be very symbolic in African practice, as well as carrying magical properties. Plants outside of healing practices are also used to control weather patterns and to control particular events. And those particular events would be events that have particular significance in communities. So utilised to help to mitigate those events as they occur inside of communities. Seeds, twigs and leaves of plants are chosen for the colours that they possess, and particularly the relationship of those colours to the different illnesses and the different healing properties that they carry. Traditional African healers also employ the use of charms and incantations and spell casting. And the picture that you see here shows drums and dance. And drums and dance are used quite commonly, as well as chants, to induce spirits in traditional healing practices. And that's something that you see common beyond African practice in a lot of Indigenous medical practices. And we also see in Indigenous healing practices in Africa the utilisation of insects. And this is really quite significant in terms of using insects for their healing qualities. It's not something that we see in Western medicine, and certainly the research into insects outside of entomology is something that's quite lacking in Western cultures. So this opens up then a really significant area of research and understanding in terms of the healing properties of different insects to broaden our perspective to a greater extent. Okay, so what we're looking at here is a product that's produced in Cameroon, and this is Hepaspor, and this is used to treat viral hepatitis. There is some research conducted by National Institutes of Health at the moment looking at the efficacy of Hepaspor to treat something known as fatty liver. And toxicity studies on Hepaspor so far have shown that there is no significant toxicity at moderate doses with acute use of Hepaspor, so that's quite significant. Next product that we'll look at, or the next herb that we'll look at, is Asiga I. And Asiga I is a product that's commonly used as a herbal remedy in African medicine, and it's pulled from the bark. Used commonly in Zulus as an aphrodisiac, and it's recognised to have properties that are used in the treatment of diarrhoea and also in blood purification. This is now recognised to be over-harvested, so it is protected in some places because of that reason. Okay. We'll look here at this particular herb and its use for anti-HIV. So this is an antiviral herb, particularly significant because in Western medicine we don't have a lot of herbs or a lot of understanding of products that are used as antivirals. So this is quite significant. It's from Cameroon and from Ghana, and it's also used for anti-HIV, malarial and anti-nasal properties. Okay, this is cinchona, and we'll talk a little bit about cinchona when we talk about Western medicines later on in the semester. This particular product is indigenous to Africa, or this particular herb, is indigenous to Africa, and it has anti-malarial properties. It's a quinine and found in West African countries. The image that you see here is actually Cinchona officinalis, and this is one of the main species. This is not the African derivative. Okay, what you're looking at here is Madagascar periwinkle, and this product in its alkaloid is taken from the roots of the plant, and it has chemotherapeutic properties, and it's an anti-leukemic and a Hodgkin's agent. Okay, it's derives from Madagascar. Okay, so that's our last slide for African medicine. So before you move on, I just want you to take a couple of moments again to think about a couple of things that you might not have thought of, and to look at a couple of things that you can review. So food for thought. What do you see as being the benefit of the continuation of traditional medicine in Africa, particularly the spiritual component of the continuation of practice as it exists in traditional medicine? And for your revision questions, explore some of the reasons behind the barriers to the integration of conventional and traditional medical systems in Africa. And then name 3 Indigenous African medicinal herbs and their modern uses. Thank you so much for being with me through this session, and I look forward to seeing you in future sessions.